Okay, so in this video I'll be taking you on how to take history and a little bit of your physical findings and important investigations you need to do in a patient with acute gastroenteritis. So the first thing you need to ask is the onset. The onset is very, very important. Very, very important. When it started. Are you getting me? And especially at the timing of the symptoms from the last food the person ate, because there are certain organisms that actually they form preformed toxins, and you see that with Bacillus cereus and Staph aureus. Okay, so beyond then after the onset, you need to ask the number of episodes. Now, I know at times the patient might not be able to tell you, but then do your best to substantiate the number of episodes per day. It won't be nice if your examiner does not hear the number of times. If the patient is telling you that on some days twice, on some days 3 times, on some days 4 times, just make an average of the number of times. Do you get? And the next thing you need to do is talk about the quantity of each episode. We talked about onset, number of episodes. Now the quantity. Now at times the patient might not be able to tell you that okay, this is the 50. It is 50 meals. It is 20 meals. But what you can do is this. By the patient's bedside, you have normal saline container, which is approximately 500 mils. So you can ask, like, how many of these, like, what quantity of this would you say you passed per time? Now, another thing you can use is, you see that methylated spirit, it comes in 100 mils. So you can use that one to ask the patient that, using this methylated spirit container, like how many mils did you pass each time? That's that. Then you need to talk about the onset. Sorry, the content. Now, regarding the content, is it mucoid? Is it bloody? Does it contain plop? Does it contain pus? Yes. In some diarrhea conditions, you can see pus. And when you are seeing pus, it has actually invaded the intestinal tissue. Is it bloody? Does it contain recently ingested meals? Now, when you are seeing recently ingested meals, you should be suspecting malabsorption. Are you getting me? Then, is it another thing which I should have added here is it what like frank water? Now, in cholera, it is more of frank water, watery, massive, which is described as a rice water stew. So you need to talk about the content. What does it contain? Then, is it fatty? Still on the content, because there are some stools that by the time they pass it, you can see the stool floating. You need to ask about that too. Is it bulky or difficult to flush? Now, beyond that, there are some associated symptoms you need to find out about, like vomiting. And if there is vomiting, you need to also characterize the vomiting, the number of episodes of vomiting, the content of the vomiters. Are you getting me? Okay, and the volume of each vomiting. Then you need to talk about abdominal pain. There are you see Shigella, Salmonella, and Campylobacter. They are notorious for causing cramping abdominal pain. Those three, they are notorious for causing crampy abdominal pain. Then is there history of fever? When the patient has fever, you should be suspecting um an infectious cause. Now, following that, the next is want to clark about risk factors and related etiology. So 24 to 48 hours dietary recall, you need to ask, What did this patient eat in the past 24 hours, in the past 48 hours, because of the incubation period of whatever organism the patient might have ingested. Are you getting me? So you need to ask. And if this patient bought the food from all the roadside vendors or people who have poor hygiene, do you understand what I'm saying? Then you also need to ask history of similar symptoms in household members. Now you know that by the time by the time you are hearing that a family went for a party, and by the time, let's say, a family of 6 went for a party, and by the time all of them came back, all of the 6 of them came down with acute gastroenteritis, you should suspect that this is food poisoning. They must have eaten something contaminated at the party they went to. Are you getting me? Now, you need to ask of, yes, history of similar symptoms in the household, and also if other, that's history, if they also ate out of that same food. It is very important, you need to know it. But then history, place of residence, where the person stays, any recent outbreak of diarrhea disease in the person's immediate environment. You need to ask about history of travel to an area with with recent outbreak. Currently now we have an outbreak of cholera in Nigeria, and Lagos is on the top list. Any history of travel to area with recent outbreak is very, very important. Also, source of drinking water. Is it well water? Is it water from stream? And you know that those things could actually be contaminated. Then also method of sewage disposal is also very important. Then there's something which I should have, yes, okay, I'll talk about it in the next one. Then consumption of raw milk, raw meat, fish, or unwashed vegetables. Hmm? They are actually important. They are very important because by consuming things like raw meat or fish, they're actually ingesting some organisms which are implicated in acute watery diarrhea. Now, food handling practices. Do they wash their hands? Eh? Do they wash their hands after using the toilet? Do they wash their hands before preparing food? Do they wash? You need to ask about that. Then food storage. Do they leave food open that flies will be perching? You need to probe about that. If these are important histories, then you also need to ask about the food, any food allergies. Some persons react to shellfish, and the way they present is acute gastroenteritis. So you also need to ask about carbohydrate intolerance. Some persons have lactose intolerance, so yeah, when they eat milk products, they start having diarrhea. Then you also need to ask about drug history, and drugs that have been implicated, laxatives. Now, at times, some persons might take overdose of laxatives, antacids, especially those one containing magnesium salts, antibiotics, and these antibiotics, it is implicated in in pseudomembranous colitis, such that by the time they've used too much antibiotics, they've destroyed the normal flora, and the story like that. Use of abuse of antibiotics. Then use of colchicine, gold. So you put it there that no prior history of use of laxative, not on any antacid, no history of antibiotics abuse, no history of use of colchicine or gold. Those drug histories are important. Okay, they're important. What else again? Yes, food substances like caffeine. Caffeine, it actually causes a form of secretory, an osmotic form of diarrhea. So ask, and do they take abuse caffeine? Heavy intake of fruits and vegetables, fruits and fruit juices, animal exposure, exposure to young dogs and cats have actually been implicated in Campylobacter infection. Campylobacter infection. Are you getting me? Then sexual history. We're asking sexual history because of HIV AIDS infection. One of the manifestations of HIV is the unexplained watery diarrhea. Are you getting? Also, you need to ask about eating disorders. Some persons, they might have an eating disorder that after eating they just go and use laxative. You also need to ask. You might these things. If you don't take your time, sincerely, diarrhea is something that should be cracked in details. As for issue of systemic illness like hyperthyroidism, they have watery diarrhea in hyperthyroidism. Diabetes mellitus, they have a form of autonomic neuropathy such that they have this thing they call nocturnal diarrhea. Now, having asked about all these questions, you want to ask about complications, and dehydration is key. Any weakness, lethargy, ask. Are you getting me? Any feeling of fainting, you need to ask. Yes, electrolyte imbalance, you might not ask, like there might be nothing to suggest it, but patients can come down with seizure as a complication of prolonged stooling, altered consciousness. These are complications. Then you talk about the care so far. What have they done? It's very important. Now, after that, let's move to the next one, which is key findings on examination. That is, you examine a patient with acute gastroenteritis. What are the things you are looking out for? The hydration status of this patient is very important. Hydration status, and there you are looking at the mucous membrane. You are looking at the mucous membrane. To be sure, is it dry? Is it wet? You also assess the hydration status, the vital signs too, the temperature, the pulse rate, the blood pressure. They can actually have something they call orthostatic hypotension. So if you are seeing a patient with acute watery diarrhea, when you do the blood pressure on lying down, are you getting me? You must do it on sitting or standing up, because you must be found demonstrating that this patient does not have orthostatic hypotension. So you do the BP in lying down, then following the lying down, you also tell the patient to stand up, or probably the patient can sit down, and you also do it. And that orthostatic hypotension is when the difference between the systolic is 20, greater than or equals to 20, and the diastolic greater than or equals to 10. That's the difference when you compare the standing and the sitting. Then the abdominal exam, check for tenderness, check for distension. Also, you need to examine these two grossly. Are you getting? Now, you might be asked, how would you? So, your diagnosis, acute gastroenteritis. That's your diagnosis. Are you getting me? Is it secondary to food poisoning? Is it secondary to laxative abuse? Now, they will ask you, how do you want to investigate? First thing, see, this patient is purging. He's passing stool. Your first thing is this tool, investigate this tool first. So you want to do stool sample for for cysts. Are you getting me? Also, MCS, microscopy culture sensitivity. Also, you want to do fecal leukocytes for WBC. When you're seeing WBC, it means that this is likely an inflammatory condition. Are you getting me? Then you also need to do I wrote something down, stool pH. Stool pH. When you are doing the pH and it is less than or equal to 5.5, you should be suspecting carbohydrate intolerance. I'm coming. You should be suspecting carbohydrate intolerance. Or you are seeing substrates. Substrates in stool. Those are, it's a sign of carbohydrate intolerance. Now, having investigated the stool, other things you want to check is full blood count plus differential. And the likely things you might see on this full blood count is if the dehydration is so much, you are going to be seeing hemo concentration, PCV, will be up. Now, if this is a case of an infective process, WBCs will be up, neutrophils, sorry, neutrophils will be up too. Then also other investigations are abdominal pelvic ultrasound scan, electrolyte urea and creatinine, because you need to assess the electrolytes. You need to assess the electrolytes. Also blood culture. Then in some cases you can do immunoassay for viral antigen and for protozoal antigens. At least if you've measured, you must mention this first one. This, at least this before you think of talking of immunoassay. Are you getting me? Then I though it's not part of this video, but I just said I'll put it. And in management, three things are important. One, fluid replacement. It is very important. Two, nutrition. Three, antibiotics and their indications for use of antibiotics in acute gastroenteritis. Okay, so if you have any questions, kindly drop it in the comment sections. Thank you.